Consider this, a program of issues and information behind today's news.
Lola May can't have hearing aids and can't be helped. She just has to struggle. It's affected her speech and language, which has affected her confidence. I think my decision not to vaccinate with Lola May, I kind of thought that if everybody else had done it, I perhaps didn't need to. And that complacency cost us so much as a family.
Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, measles. Joining us to talk more about it, Dr. Mark Rupp. Dr. Rupp is professor and chief in the Division of Infectious Diseases at UNMC. Thank you so much for being here and welcome.
Thanks, Kathy. Really my pleasure to be here too.
Let's start off by talking a little bit about maybe a day in the life of an infectious diseases physician. What's that like for you?
Well, we obviously specialize in the care of patients with infectious diseases. And so we see usually the tougher cases, the garden variety things, the UTIs, the pneumonias. We generally don't get called for those sorts of cases. So we get called when a patient has a particularly severe disease. Perhaps the pathogen is very resistant to our current antibiotics, and so the clinicians need a little bit of help of choosing the right antibiotic or the right combination of antibiotics. And frankly, we get thrown some of the curveballs once in a while. So people see somebody who looks like they might have an infection, but they can't figure out really what it is. That's where we step in and try to help with making that diagnosis.
Okay, and how did you become involved in this particular area?
Well, it's a lengthy training period, so you go through your general undergraduate degree. Mine was in chemical engineering, but people have different backgrounds. Then medical school, and then all infectious disease doctors first have to go through training in internal medicine and then take specialized training in infectious diseases.
Wow, and you talked about you having the more complicated cases. Give us some examples of what it is that you are seeing right now in your profession.
Sure, so again, and many of your viewers are aware of this increasing phenomenon of antimicrobial resistance. So every day in our hospital we have patients where the organisms are so resistant to antibiotics that it's very, very difficult to treat those infections. So we're often called in on those cases to try to figure out what's the right drug or the right combination of drugs to try to help that patient hurdle that infection and recover. So that would just be one example. In our medical center, we obviously do a lot of advanced surgical techniques. We do transplantation, so we have immunosuppressed patients that are very, very prone to infection. So we're called in on those cases, again, to try to help treat the infection, but even more importantly, sometimes our role is to try to prevent infection. So what antibiotics or antifungals or antivirals can we put people on to try to prevent infections? How can we devise policies and procedures to make the risk of infection as low as we can across the board for all of our patients?
Wow, infectious diseases, we're talking about things like, well, one of the most common right now that we're hearing about seems to be, drawing people's attention is Ebola, right?
Sure, and so this is something that we do need to be aware of, we do need to be concerned about. I think that, luckily the outbreak is really diminishing in Africa, which decreases our chances of being exposed to that here in the United States. Luckily, we've got a few units around the country, like the one at Nebraska, where we can safely treat these patients and not have much of a risk of exposure to the healthcare workers or certainly to the public in general.
Okay, and another one we're hearing quite a bit about these days, measles. What are the measles? How do you define that?
Well, measles is a viral infection that used to be incredibly common in the U.S. and throughout the world. It's an infection that usually strikes a child at a fairly young age and causes a spectrum of symptoms that we can go over. There isn't any treatment for it, but luckily it's a very preventable disease. We have a very, very effective vaccination, and that's where we really need to be putting our efforts to try to keep this at bay and not having it come back into the United States.
Right, and we want to put a chart up for our viewers just to kind of give folks an idea in terms of numbers, where we've been and where we were, especially just last year, Doctor. So kind of walk us through this.
Yeah, so this is a great chart that's from the CDC, and what you can see is that really for the last 10 or 15 years we've had very, very few numbers of cases of measles, oftentimes less than 100 cases per year. And these are generally the result of patients coming in from other parts of the world where there still is measles. And there's been very, very limited amount of transmission within the United States because we've been having such an effective vaccination campaign. Now what you see on the end of this slide, on the right side, is that unfortunately here in the last few years, last year in particular, we had a really large spike in measles case, up over 600 cases per year. And thus far this year, in 2015, we've already had well over 100 cases. So in the first month and a half of 2015, we've already outstripped where we've normally been for an entire year.
Yeah, so what's going on? I mean, you know, you had 2014, you had said that things were pretty calm up until that point. So what are the experts saying in terms of the core cause for that?
Well, unfortunately, there are increasing numbers of people, for maybe a variety of reasons, that are choosing not to vaccinate their children. And therefore, we have a pool now of kids that are vulnerable. And measles, unfortunately, is one of the most contagious diseases that is known to man. So if you're in the vicinity of somebody who has measles and you're not immune to it, so you've not received the vaccine, you have about a 90% chance of getting sick. So again, it's extremely contagious, and it's not a trivial disease. I mean, a lot of people think, oh, it's one of those mild childhood diseases, everybody got it, nobody had any problems from it. That's really not the case. Measles can be complicated by a variety of things and is unfortunately sometimes associated with death.
You're talking kids, so in terms of ages, can you be more specific there, the age group that tends to be at greater risk?
Well, when it was so common, people would get it when they were young children. So generally before school age, kids would contract measles. Now, as there's limited numbers of cases, people are getting older and older, not being exposed to the virus, so we now have adults that could be vulnerable to it as well. Now, typically the highest risk groups for complications of measles tend to be the very young, so oftentimes kids before they can be vaccinated and protected, and then people who are immunosuppressed or have other problems that would predict a bad outcome.
Okay, let's take a look at, and we have a few photos as well as a video, but let's start with the photos, the early kind of signs and symptoms of this.
So this is a rash that occurs in somebody's mouth. We call it an endanthem, and you can see little spots on the palate of this patient, and that's a very early sign of measles. Typically what happens is somebody develops measles is that they go through an incubation period of somewhere around a week to 10 days, and then they start getting ill. And this is one of the first signs that you can find on your physical exam to indicate that they might have measles.
Okay.
And then this is exactly the same sort of finding. You can see, your viewers can see this kind of on the cheek on the inside, those little small white dots. These are called Koplik spots, named after a physician that described this back many decades ago. And this again is a very early sign of measles before they develop the rash.
Okay, and is that painful what we're seeing? Because to look at it, you know, you would think that it's painful, but what are the people with that actually feeling?
So as measles develops, usually it's just a lot of upper respiratory symptoms. So you have a lot of nasal congestion, some cough, some sore throat, your eyes become inflamed. Those are all very common symptoms of measles. About that same time, you're having these lesions within your mouth. The mouth lesions actually are very painless, and most people don't even realize that they're there. Then as you get into the illness, at about day 4 or so, that's when you break out in the rash. During those first 4 days, you're also running fever, sometimes very high, 104, 105 degrees is not unusual. The tricky thing is also that people are very contagious prior to developing the rash, and the rash is one of those most characteristic findings. The first few days, you know, when you have all these respiratory symptoms, you can kind of confuse it with a cold or the flu. Then you break out in the rash, and it's the aha moment where, oh my goodness, they have measles at this point. But they've been able to spread that virus, again, very, very contagious, for usually 3 or 4 days before clinicians trip onto the fact that they've got measles.
Yeah, and the aha moment pretty obvious when it comes to that. We do have a video, and we want to put that up. And as that video is playing, we just ask that you talk over that. I think a picture's worth 1,000 words, but this video is really a little jolting. So
let's watch it. So this is a child. You know, it looks like in the early stages of measles. She looks pretty miserable. You can see her eyes are very inflamed. They're tearing. You can see some nasal congestion and runny nose. So these are all very characteristic findings of early in the measles. Now this young lad looks like he's got a bit of a rash there on his face, and that's typically where the measles rash starts, and you can see it much better there as he turns to the side. And then it spreads from the head and neck down through the whole body, and you can see again a lot of upper respiratory symptoms, coughing, runny nose, and the kids unfortunately are just miserable through this whole episode. I think that's underappreciated, really, how sick this can make even otherwise healthy children.
wow. And talk again, because you're talking about how absolutely contagious it is. It's transmitted. You almost just have to be existing next to somebody, right? If you haven't been vaccinated, you're open game.
That's correct. So this is one of those diseases that we worry that spreads by what we call an airborne route. So people who have the disease, as you saw in the video clips, have a lot of respiratory symptoms. They're coughing, they're shedding virus in the air around them. It can stay suspended for several hours, can waft on the air currents. And so if you're in the vicinity of somebody with measles and you're not immune to it, there's a really strong likelihood that you're going to get it. The statistics suggest about a 90% transmission rate. So it's one of the most contagious diseases that we know. And again, this is not a trivial disease. Most people don't remember back to the 1950s and 1960s when we in this country had 3 to 4 million cases per year, tens of thousands of hospitalizations, hundreds of thousands of complications. Typically, people would develop a middle ear infection, pneumonia or lower respiratory tract infection, so they could get croup or a bronchitis. Some of the worst complications is when it gets into the central nervous system. So people would develop encephalitis, and then oftentimes either you lose your life or you're left with permanent disability.
Yeah, and I mean, that's so a couple of misnomers that I want to get rid of here, that even if you're a healthy person overall, you rarely get sick, if ever. You're still, if you haven't been vaccinated, you're still going to be just as susceptible as the next person. True?
You're going to be back in that situation of the 1950s and 60s where we saw this disease very, very frequently. So even though you're a young, healthy person, you've got a very strong likelihood of developing measles unless you've been vaccinated, or if you were born back before 1957, the chances are that you got the disease when you were a kid. So we don't really worry about our older population, but if you haven't received 2 shots, you should.
Okay, now does this generally, regardless of age and your health and so forth, does it generally play out initially the same way in everyone? So the pictures that we saw, the video that we saw, that's pretty typical for anybody who would then get the measles, and it plays out over a certain number of days. Recap that for us in terms of what can be expected regardless.
Yeah, so again, it goes through an incubation period of about a week. Then you go through this prodromal period where you have a lot of upper respiratory infections. You can see the little spots in somebody's mouth. Then comes the rash at about day 3 to 4. That's usually when a clinician figures out that somebody might have measles. People tend to be contagious for 3 to 4 days before they get the rash, and they tend to be contagious for 3 to 4 or 5 days after they get the rash. So there's a good week period of time when people can be spreading this virus. Extremely contagious, and again, if you're not immune, you're probably going to get it if you're anywhere in the vicinity of somebody with the virus. So here, anybody in the studio, your cameramen, the people upstairs, they could all come down with measles if I had it. This is why it's so important to go ahead and get those vaccines. It's a very, very effective vaccination. With 1 shot, which is recommended at age 12 to 15 months, is typically in the 90 to 95% protection range. With a 2nd shot that is recommended when kids start to go to school, so about age 4 to 6, we're boosting the level of immunity up to the 97, 98%. So this is a really very effective vaccination for a disease that, as we've already talked about, is pretty serious.
You said no treatments really. It has to play out the way that it's going to play out, or once I come to see you and I say this is what's going on, what are you able to do to make me feel at least more comfortable, if nothing else?
Well, unfortunately, we do not have any medications that are really active against the measles virus, so it pretty much does have to play out. We do give supportive therapy, obviously, if we were to see somebody like this, which would be fluids, pain medicines, things to keep the fever down. If somebody had a febrile seizure, we could give them anti-seizure medicines, things like that. But there isn't any real specific medicine that attacks the virus itself. And those most feared complications of encephalitis, deafness, mental retardation, those things, we unfortunately still can't intervene in that. And then there's one very interesting late complication of measles that to this day is not fully understood, and it's called subacute sclerosing panencephalitis. So people who, after they've had measles, oftentimes years later, sometimes decades later, can develop this encephalitis picture, which unfortunately oftentimes progresses to death. Now that's pretty rare, but unfortunately is one of those complications that's well described due to measles.
Now say that again. So if you've had it, it could come back, but it's slight, you're saying. And paint a picture of what that would look like in the event that somebody would be experiencing that.
So this is a tricky diagnosis where people would come down with a condition which we would call encephalitis. So it's a brain infection. So this would be manifest by altered mental status, changes in personality, overall global central nervous system problems. Again, it is very mysterious as to why it strikes some people, and the vast majority of people don't get it. And it usually takes 7 or 8 years from the time you have measles to the point where you develop this kind of panencephalitis picture, sometimes decades. So it's a scary situation. Again, completely preventable by vaccination.
So let me ask you something important enough then for people who maybe they don't recall if they had the measles when they were a kid, right? Is that important enough for them to go back and kind of trace their history so that they're at least aware that that's what happened then and this is what could or not?
Well, I think it's important for folks, if they really don't know what their vaccination history is, to try to go back and trace that. If they've had an exposure to measles, then clearly they want to know about it, because there is some data to suggest that if you give somebody a vaccination at about the same time of exposure, that you can actually protect them from the measles. So that would be a good reason to know about your exposure history and to also know about your vaccine history. Now, if you're a person that is working in a higher risk environment, for instance, you're a healthcare provider, we want to make sure that our providers aren't going to be developing measles and then potentially spreading this very contagious disease, particularly to people who don't have intact immunity. So we screen all of our healthcare providers as they come into our system to make sure that they're immune. If they're not, then we give them that shot.
Okay, and I want to talk a little bit about the vaccination in terms of really what's in this stuff, right? I think there are folks out there who might not necessarily mind being immunized, right? But they just want to know more about what's in the vaccine. Can you talk a little bit about that in terms of the measles that way, so that if I'm getting a shot, I know what's really going into my system, right?
Sure. So the measles vaccine is usually combined with other viruses that we're trying to protect against. So the most common of these is called the MMR, or measles, mumps, rubella vaccine. And now you can actually get varicella tagged with that. So you can get measles, mumps, rubella, and varicella all at the same time. Very safe vaccine. Very, very effective. Again, 90–95% protection with just that first shot. And then again, with the booster, it's even higher. Now, this is a live virus vaccine, so the virus that's in it is attenuated, doesn't cause disease, but it is not indicated in certain individuals. So if you're very immunosuppressed, we wouldn't give you this vaccine. If you're a pregnant woman, we would not give you this vaccine. But pretty much everybody else can safely be vaccinated. Now, that's not to say that there aren't side effects and toxicity from the vaccine, and those are well described and well known, but they, I think, far are outweighed by the risk of measles and the risk of this disease coming back into society and then causing the havoc that we've been talking about. So it's not unusual for people to have soreness of the arm, obviously, when they get the vaccine. It's not unusual to have fever with the vaccine. Most of the other side effects are very, very rare as far as having a seizure or having any other kind of really adverse event from it. So again, these are described. It's known that there's a few adverse events that are associated with the vaccine, but by the most part, they're fairly mild, and you can blunt them with a little bit of antipyretics, so giving somebody a little Tylenol or Motrin along with the vaccine helps to really blunt those things down. Again, if you look at the data, the risk to society for us to stop vaccinating is just horrendous. I mean, it will not be long before we're back to that status we were back before vaccinations of having hundreds of thousands, if not millions of people getting sick from preventable disease. And so the mother who was on your video clip where she said she made the decision not to vaccinate her child, if everybody else got vaccinated, she'd be right. Unfortunately, we live in a society, we got to be team players, and this is what you do to help protect everybody. And so it's part of being a citizen, it's part of being responsible, it's part of being altruistic and helping your fellow man. We want to have everybody vaccinated so those few people who can't get vaccinated are protected. And again, there's the 1 or 2% that don't respond to the vaccine. So again, if we have herd immunity, everybody else around them is immune, they won't get sick either. So it's important that we all help each other do the right thing and get these vaccines.
Okay, I want to go back to something that you said earlier when you added a fourth one, right? Mention that again.
So this is the chickenpox vaccine.
Okay.
So you can actually get vaccinated now for measles, mumps, rubella, and chickenpox with one shot.
Okay, and let me ask you this question because in doing a little bit of research here for the program, I found in 1991, and actually it was NPR, an NPR report, Philadelphia outbreak, right? And there was controversy over making me have the vaccine versus my electing to have the vaccine. I'm hearing you say very important, obviously. So what would you say to folks who are still on the fence thinking, well, I'd like to make that decision myself, fearful that somebody else is going to tell them that they have to do it? What would you say to that individual?
Well, I think this is a very interesting question. And how do you balance public health, societal benefit with personal freedoms? And in our country, we've tried to have personal freedom as much as possibly you can, but there are instances, I think, where, again, societal benefits outweigh that. And I think this is one of those examples, where if everybody does this, we're all protected. If a small subsegment doesn't, then unfortunately many of us are at risk. And a perfect example of that is rubella, for instance, the German measles. So that's part of the MMR vaccine. Now, rubella is a minor disease for folks, but it is absolutely horrendous for the developing fetus. So back before we had this vaccine, we had thousands and thousands of children who were born mentally retarded, blind, deaf, devastated. That's why we get the vaccine, to protect the unborn child. It's not actually to help the person who's getting the vaccine, it's a societal benefit. And so I think that, again, the benefits of doing this across the board for folks is really worth it.
Okay, so doctor, walk us through then for the viewers watching thinking, oh, I'm not sure when the last time was that I had my child. You know, they just need to go back and look at records, call a pediatrician. What are just some of the common steps that we would take? And even for the older viewers watching, you know, who want to go back then to find out what's been done, walk us through some first steps that we should be taking to make sure that we've been properly.
Yeah, so the vaccine tracking systems now are better than they were decades ago, obviously. Much of it is electronic now that folks can pull this up. Here in Nebraska, we actually have a more global tracking system that people can participate in so that it's more generally available, that information, and it's easy to track. For folks who aren't available, that can't take advantage of that, sure, just contacting your physician's office, finding out if you've been vaccinated would be a first step. Now, if there are higher risk individuals, so for instance, the example we used of healthcare providers, that might be a good time where you actually do check a blood test to see if you're immune. And any of your viewers could go to their physicians and get this test. It's a simple blood test. It looks for levels of antibody in the system that would predict for immunity. And if it wasn't there, then they could get a booster dose.
Okay. Now, if we suspect that someone has the measles, right? Or because I can tell what's going to happen now, folks are going to kind of be a little bit overly cautious maybe, or even paranoid that their child might have this. So first of all, help alleviate those fears. But secondly, if we want to just check and be proactive, what are we looking for, and what do we do if we suspect that someone has it?
So again, the most important step is prevention. So if your child is up to date on vaccines, so got that first dose at 12 to 15 months, and again when they started school, the chances of them developing measles is quite low.
Okay.
Public health is obviously really in tune to this right now, because we've had 2 cases in Nebraska. We've got the nationwide outbreak related to the Disneyland exposure, which is kind of an interesting topic in and of itself. Probably somebody coming in from parts of the world where they have measles, mixing in Disneyland, and then infecting hundreds of people now across the country. So it just shows how mobile the population is, how contagious this can be. So again, going back to your discussion, what you want to do is make sure that you've been vaccinated, make sure that you're protected. If you suspect measles, this would be something that you would be calling your provider and saying, I have reason to believe that I was, in those places that public health has designated as possibly being exposed to on those dates. We're past that incubation period now, by the way, so we're really not at risk. But this is the way you would approach that. You'd say, I was in that vicinity when the person was known that had measles, and therefore I'm possibly at risk, and now it's been a week and I've got a runny nose and watery eyes and feel bad and running a fever. Better tell somebody. Okay, and in about the minute that we have remaining, final thoughts, things that maybe we haven't talked about up to this point that you think is important for the viewers to know about this issue? Well, I think the most important thing to get across is that these diseases have not been eradicated throughout the world. In the United States, we've done a good job, but they're still out there. And they're lurking, and they're just waiting for us, because of ignorance or neglect, to let our guard down. And once we do that, they're going to be back. So we can prevent it. This is a disease we have a good vaccine for. It's something that we just really don't have to suffer with anymore. Get vaccinated and get rid of this disease. This is a disease we could eradicate from humankind, just like smallpox. The only known reservoir for this is humans. If we did a good job of this worldwide, it's a vaccine we could potentially pull off the shelves and never have to use again.
Okay, thank you. And if folks want to learn more about this particular topic, we would encourage them to go to the CDC website. So there it is on your screen, cdc.gov/measles for more information. Dr. Rupp, I just want to thank you for being here today and for sharing your time and expertise and really kind of educating us on what this is truly all about. So often we get things in 30-second sound bites that it's nice just to have this kind of a conversation to give folks more information.
Sure, my pleasure.
Thank you very much. And thank you all for watching. We'll see you next week.
Consider This is an issues and information program produced by UNO Television. More information can be found at unotv.unomaha.edu. If you'd like to share your comments about this show, call UNO TV at 402-554-2516 during regular business hours, or email us at considerthis@tvmail.unomaha.edu.